Good morning, Belize, and welcome to, I'm Dwayne Moody, and I'm here at the tarmac of the Phillip Goldson International Airport, where a first batch of AstraZeneca vaccine through the COVAX facility is going to land momentarily here in Belize. Now, we have confirmed with the Ministry of Health and Wellness that Belize is expected to receive 238,800 doses of the vaccine within the first 2 quarters of 2021. Today, however, we are receiving 33,600 doses, and that's coming on an Amerijet flight at about 11:15 today. It is one good day for the country, specifically because we've reported of receiving of donations courtesy of the Barbados government as well as the government of India. 26,000 doses of vaccines were donated by these countries to the government, and the rollout process has already begun. We are actually in phase 2, where parliamentarians, the tourism industry, as well as teachers are able to get vaccinated. We know that in the first round of the vaccination process, there was, of course, a vaccine given to the priority group of older persons, 60 and older. But let me continue with some additional details, guys. Now, from what we know, the COVAX is a part of this tool and access to COVID-19 tools, which helps with the development and equitable distribution of tests, treatments, and vaccines to countries, low and lower income countries. There are 92 of them in the region, and they're just ensuring that all these persons, all these countries, their health systems are developed and that they can too get vaccines and help in the fight against the COVID-19 virus. Today I can tell you that there are a string of activities that are happening. After the plane lands, the vaccine will be offloaded, and after it is offloaded, a brief official ceremony will take place. Right here, setup is happening for that, and we will have full details of that. We'll be bringing that to you live. Now, if you are tuning in, you can, of course, go to Channel 5's Facebook page and even UNICEF's Facebook page, where this is being broadcast live. Again, we are here on the tarmac at the Phillip Goldson International Airport, where around 11:15, a first batch of COVID vaccines through the COVAX facility will land via Amerijet right here on the tarmac. During today's live broadcast, I will be speaking with some key stakeholders in this fight against the COVID-19 vaccine. We have Dr. Natalia Larga-Espada-Bear from the Ministry of Health and Wellness, who is one of the focal points on this. We'll also have UNICEF representative Miss Alison Parker, because UNICEF is very key in the distribution, etc. of these vaccines, and the acquisition of the vaccines. We'll also have Dr. Noreen Jack of PAHO. They're also a part of this process, of course, because it's from the PAHO revolving fund that Belize is able to acquire. Belize and the rest of CARICOM states are able to acquire the COVID-19 vaccines through the COVAX facility. Right now I have with me Dr. Bear. Again, let's talk about this COVAX facility, Dr. Bear, how it came about, what it's all about.
COVAX facility is a procurement mechanism for COVID-19 vaccines, and the goal is to have equitable and fair distribution of COVID-19 vaccines to all countries around the world. Countries need to sign up with COVAX facility, and at this moment, because the production is low, vaccines, countries were allowed to sign up just between 10 and 30% of their total population to be vaccinated. So today is our first shipment from the doses that we have secured through COVAX, which is 238,800 doses.
Talk to us about seeing this take place, where we're finally getting at 33,600 from COVAX facility, realizing this. How do you feel about this?
Yeah, well, this process started last year, third quarter, and since then we have been working with the different partners to secure the doses that we are procuring through COVAX. So it has been a long wait, but it's worth it. It's worth it because it will allow more Belizeans to be vaccinated and put us in a better position against COVID-19.
It's about achieving herd immunity. For those who don't know, talk to them about what that means.
Well, countries had the options to choose for natural herd immunity or through vaccination. And we all know the numbers that countries are facing when it comes to morbidity and mortality related to COVID-19. So worldwide, the decision was made by all governments to achieve herd immunity through the use of vaccines. So it is expected for us, because our population is young, to cover at least 58% of the total population.
Now, what we know from the sessions that you've had with the media, from the sessions that you've had, that the consultate, all the talks that have been had with the public, it's that even if you're getting vaccinated, it's only an additional protection against the virus, but it doesn't stop you from catching the virus. You still need to practice social distancing. You still need to wear your masks and all of that. Talk to us about that. Why people should get vaccinated.
At this moment, the best value of all the COVID-19 vaccines is to save lives. And that means a reduction in the number of severe illness, hospitalizations, and death due to COVID-19. So a person that is vaccinated, there is a range from 5 to 40% or 38% that can become infected with COVID-19, but it will be mild. They will not know that they are infected with the virus, but they can transmit the virus. Hence the need to continue with the precaution measures, masking, sanitizing, cleaning surfaces, physical distancing, and staying at home as much as possible.
Now, do you know what type of vaccine we're getting today?
Yes, today we are getting 33,600 doses of AstraZeneca.
All right. Thank you so much, Dr. Bear. There you have it. That was Dr. Natalia Largus Parda Bear. She is a focal point from the Ministry of Health, and honestly one of the point persons when it comes to the vaccine rollout here in Belize. As you know, we have the rollout process has begun. We know that we're in phase 2 of administering the vaccine, where older persons as well as persons within the tourism industry, teachers, parliamentarians, they are all being asked to come forward, go to these different COVID stations and get vaccinated. I am also here now with one of the key partners actually in the COVAX facility and the rollout of the acquisition of vaccines to 92, I believe, low and lower income countries, just to ensure that there's equitable distribution of tests and vaccines to all these countries in the fight against COVID-19. I'm here with the country representative for UNICEF in Belize, Ms. Allison Parker. Ms. Allison, talk to us about, finally realizing this COVAX facility and the distribution, the acquisition of the vaccines here in Belize.
Thank you very much, and it's a real pleasure for me to be here today. This has been an amazing partnership with the COVAX facility involving UNICEF, PAHO, WHO, the Global Fund, the World Bank, as well as Gavi, the Gavi Alliance. And they have come together to ensure equity in the distribution of the COVID vaccine. For us as UNICEF, COVID-19 has had the worst impact on children. Their lives have been upended. Their access to basic social services such as health, education, protection have been compromised over the last year. And for us it was important because the longer the pandemic remains, the more women and children will suffer. So UNICEF was part of this, and we came in to ensure that we can combine the COVID vaccine with the regular vaccination process, the routine vaccination, to ensure that all children have access to vaccines. You will observe that in Belize over the last year, due to the COVID vaccine response, our antigen coverage for routine immunization has dropped from 95% to somewhere around 78%. This is a risk for childhood preventable diseases. And so UNICEF sees it as important to come together and join forces to support this. And today is an amazing day as we receive the first shipment of the COVID vaccine for Belize.
Now, we know that UNICEF works closely with the government just to ensure that, these goals are achieved. Talk to us about that, the partnership with the government and how that's been going.
Well, UNICEF has had a partnership with the government of Belize here since 1954. And when we got independence here in Belize, UNICEF established a cooperation agreement which we renew every 5 years. And so we have been long partners with Belize across every part of the history of this country. And our key areas of intervention, one of the key areas of intervention has been in the area of universal health care, especially for children. And so that has been a mantra, and that has been a mandate that we continue to work with the government on. This is a significant move in that direction, ensuring that we bring our resources together and the resources that COVID-19 provides to ensure cold chain systems are strengthened, to ensure that the vulnerable and those who are left behind, such as migrants, asylum seekers, all of them are part of this process, and they can access the services that are much needed, especially for children.
I know that Belize is, I think this is the third or the fourth country within the region that is actually receiving through the COVAX facility. It took some time, but it's finally happening. Talk to us about the rollout, the allotment, because from what I understand, this is only 33,000 that is coming now, but sometime within the next quarter, there's supposed to be another shipment,
yes.
Right?
Yes, we are expecting another shipment in the next quarter. The details of the specifications of how many will be rolled out, we are expecting a little over what we already have now, but then we will have the confirmation as soon as that rollout is expected. And that is expected in the next 2 months at most. So let's see how it rolls. As you know, the contest continues to evolve, and the demand is huge, because never in the history have we had a global response of this nature. This is an epoch-making event for the world as a whole, and everybody is navigating that space to ensure that every country, with no one left behind, can access and attain this vaccination.
Ms. Allison, now I have to ask, and I have to put this out there. I've been doing some research, and I saw that, UNICEF and its partners, they're looking at having, I think, reaching close to 2 billion doses of vaccine in the region, I think, by 2021. And we're already nearing 1.5 billion or something like that.
Absolutely.
Talk to us about that, no?
Well, this is, I think, one of the greatest assets that UNICEF has, because over the last 2 decades, we have been working on vaccination for under 5 children. So on an annual basis, we already have been distributing 2 billion vaccines across the world as a practice. So we have the systems, we have the networks, we have the cold chain, and we have the experience in doing that. And what our partnership has done, which is key to what UNICEF is doing, is bringing that knowledge, bringing that capacity, bringing that experience to the table with the other partners in ensuring equitable rollout in as speedy a time as possible. And it's amazing the cooperation we've had with freight transport, land, sea and air, in making sure that we can move and reach the communities. And no country, even the least developed countries, are receiving their COVAX vaccines almost at the same time. This is unprecedented, and we are really proud to be part of this partnership.
History.
Absolutely.
Thank you so much, Ms. Allison. There you have it. That was Ms. Allison Parker from UNICEF Belize. Talking about how UNICEF has worked along with its partners, PAHO, Gavi, and the Ministry of Health and Wellness, to ensure that all these countries, all these low and lower income countries, 92 of them to be exact, they're also acquiring vaccines to help strengthen their health system in the fight against this deadly virus, COVID-19. I also have with me today a representative from PAHO, Ms. Dr. Noreen Jack. Dr. Jack, step right there, please. Thank you so much for joining me. Let's talk about what we're seeing here today. You know, history for the country, seeing this COVAX facility actually work.
Yes, it is amazing that this is really happening. We have been working at this for a good bit of 2020, you know, and the hope of, first of all, the hope of having a vaccine for COVID, which is really the first time in history of any pandemic. And then the delivery of these vaccines in a time that is really a short time, because this has never happened. It's usually like months or years later, and we're seeing that this within 2-3 months, you know, of the initial approvals of these vaccines. So it is amazing, and we are really happy to see this become a reality.
You know, it is all about the partnership that has been forged between all these agencies, including PAHO, who, from what I understand, it's true, it's revolving fund that, you know, these things can be facilitated, the acquisition here in Belize and elsewhere. Talk to us about that.
Yeah, so the PAHO revolving fund has been around for a while. It's over 40 years and have been delivering vaccines to people throughout the Americas, all the countries, safe and affordable vaccines throughout the Americas. So this is just continuation of this process that had begun in the past. And for the countries of the Americas, PAHO Revolving Fund is the procurement and the delivery system for the COVAX vaccines.
You know, we often talk about the delays that we're seeing. Mind you, I feel like it was quick, because normally they would say that, you know, creating a vaccine, things like that would take up to a year, maybe 2 years. But we've seen that, you know, within a year, Belize is already receiving its vaccines. Talk to us about that process and I guess the efficiency that we're seeing happening.
Okay, I think we need to go back a little in time in terms of like April 2020 with the formation of what we call the ACT Accelerator, which include a number of international and global entities, including WHO, UNICEF, CEPI, Gavi, among many partners, European Union as well, in which they got together and see that we need to work together. We need to work with each other to come up with the strategies for both testing for COVID, for treatments, new treatments, and as well as vaccines. And with that global effort and initiative, that's why we're here today. But in addition to that, the COVAX facility wanted to see safe and affordable vaccines to the global population. No one country can do this alone. And vaccinating one country without vaccinating the world is not going to work. So this is where the COVAX facility wants to provide vaccines for 20% of the global population by the end of 2021, and invited countries to participate as members of the COVAX facility, and this is what happened. And of course, Belize is one, and as well as 35 other countries in the Americas.
Thank you so much, Dr. Jack.
Okay,
all right, thank you. There you have it. That was Dr. Noreen Jack from PAHO here in Belize. You know, speaking about the revolving fund and how it helps these low and lower income countries, 92 to be exact, with really facilitating this process. We are going to take a quick break, and then when we come back, we are going to have a nurse. Well, actually, she's ready. Let's talk to her one time. We have Nurse Lilia Middleton. She is the manager for the EXPAND program and immunization. So really, with the whole administering of the COVID vaccine that is happening right now, Nurse Lilia is the person. Nurse Lilia, let's talk about where we are right now. I know that in Belize, because of the donation that was given to us by the governments of Barbados and India, we have been able to start our vaccine rollout program. Talk to us about how that's been going right now, where we are.
Okay, where we're at right now, we have started with 2C, and 2C is with the tourism section. So we are urging persons 40 years and above to come in, that they're working in the tourism section, to come in to get their vaccine. We have done the healthcare workers, we have done the 60 plus, those with special conditions that were in one. Then we did the second phase, which were the teachers and the police, and so we are starting the second phase, which will also integrate those from the judiciary, those from customs and immigration, and then the tourism section.
How important is this in achieving herd immunization? Because from what we understand, people are coming out, some are resistant to taking the vaccine even. How do we get them to get out there?
We have to let them know the importance of the vaccine and how it protects the community, not only the community but our country itself. And then people will want to come back to our country, especially those that are in the tourist industry. So we have to give priority to those that need the vaccine, those persons that are there that are in contact with a lot of persons. That is what we're looking at.
Now, can you speak to those at home? Because I understand that there are some older persons that may not know that it is their time to come out and get vaccines. How do you convince them to come out?
Well, we have persons on the communication team that go out and talk about the vaccines, and we also are encouraging those persons that have Facebook, WhatsApp, and even on the radio stations, they're hearing it on the phases that are being open. And so persons that are at home and those that cannot come in to get the vaccine, we also go to them and give them the vaccine. We have an app that is being opened soon, and that app you can register to get the vaccine also from home.
Now, from this, what's the next step? Because with these 33,600 doses that we're getting today, it means more people can get vaccinated. Do we then go to step 3, to phase 3?
Well, we will work with step 2, and then if they're not coming in, then we go to step 3. But we are urging those in step 2 to please come out and get vaccinated to protect yourself, to protect your family, and to protect your community. And also to prevent hospitalization, because the vaccine basically is for prevention. But even though we are getting vaccinated, you still have to use the other protective measures, such as washing your hands, maintaining social distance, wearing your mask properly.
Okay, so the advice is for them to still do all these social distancing rules, and of course wearing a mask, doing the necessary precautions.
Yes, it is advisable to continue with these measures.
Right. Thank you so much, Nurse Lilia. There you have it, guys. Nurse Lilia she is the manager for the Expand program and immunization. As you can see, guys, I believe this is the aircraft, the Emerjet aircraft that is bringing in the 33,600 doses of AstraZeneca vaccine through the COVAX facility. It is landed. All right, guys. So again, just to tell you what is happening, we are here on the tarmac of the Phillip Goldson International Airport, where a flight has just landed with 33,600 doses of AstraZeneca vaccine. It was procured for the country through the COVAX facility. And this first batch of AstraZeneca, courtesy of the COVAX facility, is being welcomed. They are going to be hosing down the aircraft before it will come to a complete stop. Thereafter, the vaccines will be offloaded and an official ceremony will take place here at the Phillip Goldson International Airport. Within this aircraft, guys, 33,600 doses of vaccines. So this adds to the 26,000 that has already been received by the country through donation from the governments of This is after months of expectation. The COVAX facility has finally delivered on vaccines to believe. This, of course, is being welcomed by government officials as well as representatives from the various agencies, UNICEF, PAHO, and all these organizations that are part of the larger initiative to get low and lower income countries the necessary vaccines that are needed to fight against this COVID-19 pandemic. Right, so the plane is about to shut down and the process of offloading the 36,600 vaccines will take place, after which an official ceremony is going to happen right. Present at today's official ceremony is CEO Amalia Mai from the Foreign Ministry, the wife of Prime Minister John Briceño, Mrs. Rossana Briceño, she's Special Envoy for Families and Children. We also have the UNICEF rep, Ms. Alison Parker. We have the Minister of Health and Wellness, Michelle Shabat. We also have Dr. Noreen Park, who is the PAHO representative. Dr. Noreen Jack, sorry. The offloading is about to take place, guys. Let's see if we can get a little closer just to get that. All right. What we're witnessing here, guys, is the COVAX facility working. Essentially, a first batch of COVID vaccine. There's a total allocation amount, according to Dr. Bear, of 238,804 Belize. Today we are receiving 33,600 doses of COVID-19 vaccines, the AstraZeneca vaccine, courtesy of the COVAX facility. Vaccine, courtesy of the COVAX facility. In that package, 33,600 doses of AstraZeneca vaccine help Belize in its fight against the COVID-19 pandemic. As you know, currently our numbers are down with a very low positivity rate. We're going to be able to get the minister on this later on today. But we can tell you that extra precautions are being made due to the Easter weekend that is coming up. And guys, there you have it. That's our package there. Belize has received its first batch of COVID-19 vaccine through the COVAX facility. Is the arrival of a first batch of COVID vaccines, the AstraZeneca vaccine actually, through the COVAX facility to Belize. 33,600 doses have arrived in Belize. It's been offloaded, and momentarily an official ceremony will take place here on the tarmac at the Phillip Goldson International Airport. There you have it, see? Guys, they are, again, the vaccines have been inspected by customs and a rep from PAHO, and now it is being taken over to the site where the official ceremony is going to take place. 33,600 vaccines through the COVAX facility has landed in Belize. The vaccination process continues. We're in phase 2 of vaccination, where tourism stakeholders as well as teachers, you have police officers, they're still asking for older persons 60 and plus, and persons who have specific NCDs to get vaccinated, get out to a vaccination center and get vaccinated. Here's a closer view of the donation, the AstraZeneca vaccines courtesy of the COVAX facility. All right. There you have it, guys. The 33,600 vaccines courtesy of the COVAX facility. It is here. It has landed. We're going to take a quick break, and when we come back, we'll have the official ceremony for the arrival of the COVAX facilities COVID-19 vaccines in Belize. Stay tuned.
We approach the fight against COVID-19 in the way we approach many other challenges, by looking for ways to achieve joint solutions and staying resolved to help our people. I know how anxious we are to see life returning to some normalcy. The COVID-19 vaccine offers our country a reason to hope. We are in this together. I will be safe when we are all safe. I believe in the COVID-19 vaccine. I have taken the COVID-19 vaccine, and I urge you to take it too. #GetVaccinated_Belize.
It is my time
to protect your life.
Don't wait to vaccinate.
I believe in the COVID-19 vaccine.
The vaccine is the best way to protect lives.
Don't wait, vaccinate.
Don't hesitate, Belize.
Vaccinate.
Be COVID-19 safe.
If you care,
love them.
Protect them.
Vaccinate them.
This isn't the first time we've been faced with the unreasonable. For more than 70 years, UNICEF has been on the front lines of response, protecting children against preventable diseases. Together with partners, we wiped smallpox off the planet. We're doing the same with polio, reduced by 99% since 1988. We've also set ambitious targets for HIV/AIDS, committing to ending it by 2030, and we're well on our way. Our history says we can do anything we set our minds to. Big problems require big solutions. And we've got a big problem today. COVID-19 is one of the biggest fights in our history, with children caught in the crossfire. But we've got this. We're not afraid of hard work. Possible is just a reason to try harder. We will respond. We will recover. We will reimagine a fairer world for every child. Please, join us.
Of the Belizean National Prayer. Almighty and eternal God, who through Jesus Christ has revealed your glory to all nations, please protect and preserve Belize, our beloved country. God of might, wisdom, and justice, please assist our Belizean government and people with your Holy Spirit of counsel and fortitude. Let your light of your divine wisdom direct their plans and endeavors, so that with your help we may attain our just objectives. With your guidance, may all our endeavors tend to peace, social justice, liberty, national happiness, the increase of industry, sobriety, and useful knowledge. We pray, O God of mercy, for all of us, that we may be blessed in the knowledge and sanctified in the observance of your most holy law, that we may be preserved in union and in peace, which the world itself cannot give. And after enjoying the blessings of this life, please admit us, dear Lord, to the eternal reward that you have prepared for those who love you. Amen. Please be seated. Honorable Michelle Shabat, Minister of Health and Wellness, Her Excellency Rosana Briceño, Special Envoy for the Development of Families and Children, Dr. Noreen Jack, PAHO, WHO representative for Belize, Ms. Alison Parker, UNICEF representative for Belize, Mr. Nicholas Hansman, European Union representative in Belize, Her Excellency Marta Boza, Ambassador of Panama to Belize, Ambassador Amalia Mai, CEO in the Ministry of Foreign Affairs and Foreign Trade, Dr. Natalia Baer, Technical Advisor for the Maternal and Child Health Unit, Ministry of Health and Wellness, Mr. Jorge Espat, CEO, Belize Airport Concession Company Limited, Mr. Enrique Hoare, Manager of Operations, Belize Airport Concession Company Limited, other invited guests, members of the media, viewers online, at home and abroad. I am absolutely delighted to be here with you today to mark this major milestone in our journey since the beginning of COVID-19. Today, we are here for the arrival of the 33,600 doses of the Oxford AstraZeneca vaccines provided through the COVAX facility. To begin this morning, I'd like to invite Dr. Natalia Baer, the Technical Advisor for Maternal and Child Health, to give opening remarks. Dr. Baer?
Good morning to everyone. Honorable Michelle Chabat, Minister of Health and Wellness, Her Excellency Mrs. Rosana Briceño, Special Envoy for Development of Families and Children, Dr. Noreen Jack, Pan American Health Organization, World Health Organization Representative for Belize, Mrs. Alison Parker, United Nations Children's Fund Representative for Belize, Mr. Nicholas Hansman, representative of the European Union for Belize, Ambassador Amalia Mai, Chief Executive Officer from the Ministry of Foreign Affairs and Foreign Trade, Mr. Joe Henricks from the United Nations Refugees, people of Belize, and esteemed guests. Thank you to each and every one of you for being here with us today. We are very pleased to welcome you to celebrate with us the receipt of our first shipment of COVID-19 vaccines through the COVAX facility. Honorable Michelle Chabat, your drive and commitment to afford every Belizean the access to a COVID-19 vaccine is what keeps us aligned with the goal, all safe against COVID-19. Her Excellency Mrs. Briceño, we thank you for your commitment towards the development of families and children. Every dollar spent in a child is a dollar well spent. Procuring COVID-19 vaccines is a tedious process. Procuring vaccines through COVAX became effortless because of the full support we received from Dr. Noreen Jack and Mrs. Alison Parker, who work harder than I do. No matter what day of the week, what hours of the night, they were there ready to assist. A warm welcome to Mr. Hansman from the European Union, and acknowledging the Inter-American Development Bank, the UN refugees, for accompanying the Caribbean community in this endeavor. Belize, like the rest of the Caribbean member states, we do have data on having a strong expanded program on immunizations. A good example is the milestone of the last case of polio diagnosed in Belize in the year 1981, and in the entire Caribbean sub-region in 1982. 2021 represents for Belize the 40th year polio-free. Vaccines are a low-cost, intervention that save lives. The year 2020 has been a difficult year for all. The coverage of our routine vaccines was reduced significantly compared to previous years. Our public health nurses and rural health nurses are making all efforts to rapidly increase the protection of children against vaccine-preventable diseases. I take this opportunity to thank all the healthcare workers from public and private sector and the local partners, the members of the different committees, the National Coordinating Committee, the National Immunizations Technical Advisory Group, for their dedication, commitment, and support for a successful vaccination campaign against COVID-19. They've been working non-stop, including weekends, since the launch of the National COVID-19 vaccination plan. In closing, COVID-19 vaccines save lives. They are 100% effective in reducing severe illness, hospitalizations, and deaths due to COVID-19. The more people get vaccinated, it puts the nation in a better position to prevent and control new COVID-19 outbreaks. Together, we can protect those who are not eligible today for the vaccine. I believe in the vaccine. I got vaccinated. When it's your turn, get vaccinated. Have a blessed and safe Easter at home with your loved ones. I thank you.
Thank you, Dr. Bear. So far, we've received donations from Barbados and India, and today we join some of our sister countries in the Caribbean in receiving the donation from the COVAX facility. Undoubtedly, this could not be achieved without the partners. And so, to begin, I'd like to invite Ms. Allison Parker, the UNICEF representative to Belize, to share remarks.
Thank you so much, Madam Mistress of Ceremony. Honorable Minister Michael Shabat, Your Excellency Madame Rosanna Viceno, a Special Envoy for the Development of Families and Children, Dr. Noreen Jack, my co-partner in this journey, the EU representative, Mr. Nicholas Hausman, Ambassador Amelia May, the CEO of the Ministry of Foreign Affairs, Foreign Trade and Immigration, members of the diplomatic corps and the international community, government representatives here present, the media, the general public, the families, and the children at home. Today is a momentous occasion for us, and it is a pleasure and an honor for me to be here as UNICEF. A moment when we demonstrate the power of partnership in making a difference for the most vulnerable and those who are left behind. Our world was forever changed when COVID-19 was declared a pandemic by the World Health Organization in January 2020. Since the pandemic affected every sphere of society, it cost many lives. Several measures had to be put in place in each country by each government to protect its population from the pandemic. In Belize, the national response to COVID-19 required drastic measures, country and community lockdown, restrictive measures such as limiting unnecessary travels outside and within the country, closure of local businesses, closure of schools, implementation of teleworking and online classes. This created a humanitarian and socioeconomic crisis, with children being the most affected. The COVID-19 crisis has been a children's crisis. And today we are pleased to be part of this partnership in making a major milestone for families in Belize as well as the government. I want to use this opportunity to commend the government of Belize and the workers of the Ministry of Health and Wellness under the leadership of your Honorable Michael Chabat for the tremendous work that has been done. I have gone out in the fields to see the work that has been done in the COVID-19 outlets, and it has been amazing. It's been smooth, it's been fast, and it's been very responsive. And so to you and the team, it's a big congratulations. This day is also crucial. As the Minister mentioned, this set of vaccines will also be addressing some of the second phase tier that we have identified. And among those are the teachers. For us as UNICEF, this is great. And this coincides with the recent announcement by the Ministry of Education for the gradual phase-in and return to face-to-face classes. This could not have been more timely and shows the synchronization between the Ministry of Health and the Ministry of Education in making sure that every boy and every girl, as well as the teachers, can go back safely to school. I would like to therefore use this opportunity to call upon teachers out there to take this opportunity. These vaccines have come in for you. Please go out there, take this vaccine so that we can safely return to the classes with our children. As I close, I want to emphasize that vaccines save lives. This is a testament of over 30 decades of doing vaccine for preventable diseases among children. And Belize has been one of the top countries, as Dr. Beer mentioned, that has had universal coverage for immunization at 95%. Unfortunately, due to COVID-19, we have lost that herd immunity that we had attained before, and some of our antigens have dropped as low as 78%. Belize cannot afford and will not afford an outbreak of any kind among children. And that is why today we also want to announce to you, Honorable Minister, that UNICEF will be supporting the cold chain system as part of the COVID-19 response. That we will not only support the vaccine through COVAX, but we will also support the cold chain system, as well as support you with your communication endeavors to make sure that every family can understand and know what to do within this context. As I close, let me once again thank the COVAX Facility Partnership, PAHO WHO, the Global Fund, the World Bank, the Gavi Alliance, and UNICEF for such a tremendous global effort in making sure equitable distribution for every country at all times. I thank you, and it's a pleasure again to be here.
Thank you, Ms. Parker. The COVID facility was facilitated through the PAHO revolving fund, and today to deliver remarks we have Dr. Noreen Jack, PAHO WHO representative for Belize. Dr. Jack?
Good day, everyone. Honorable Michelle Chabat, Minister of Health and Wellness, Mrs. Rosanna Versino, First Lady, Mr. Nicholas Hansman, Team Leader for the European Union, Mrs. Alison Parker, UNICEF representative, and I want to acknowledge in the audience also Ambassador Mai and Ambassador Motza and other members of the diplomatic corps. I want to also recognize especially Dr. Bear. Dr. Bear, we have had discussions, as you said, all hours of the night and on weekends, and as well as all other persons in the Ministry of Health, the media present, and ladies and gentlemen. It's exactly 1 year ago that the COVID pandemic was declared on the 30th of March 2020. And it has brought unimaginable suffering to the world, globally, at national level, but globally. And during this year, we learned one thing, is that we are one humanity. And the only way to confront shared threats is by working together for shared solutions. So the COVAX facility is a global effort to ensure access to COVID-19 vaccines, and it's part of a larger initiative which was established in April 2020 to develop various tools, diagnostic tests, treatments, and vaccines to respond to the COVID pandemic. The COVID vaccines will help save lives, it will stabilize our health systems, and it will drive both national and global economic recovery. The COVAX facility hopes to end this acute phase of the pandemic by delivering the vaccines to 20% of the global population by the end of 2021. It's an alliance, as Mrs. Parker said, of many partners, including CEPI, Gavi, the World Health Organization, UNICEF, and PAHO. And I will speak a little bit about the PAHO revolving fund, and it is recognized as a procurement agent for the COVAX facility in Latin America and the Caribbean. It negotiates, purchases, and handles the shipment logistics on behalf of the 36 countries participating in COVAX in the region of the Americas. As of today, and I think with this shipment here to Belize, it's 2.5 million doses of the COVID vaccines have been delivered through the COVAX facility, through the PAHO, from the COVAX facility, from the PAHO revolving fund. I checked that last night. I knew this would be the difference that will make 2.5 million. The PAHO revolving fund has been around for a long time. It's over 40 years and has been supporting countries throughout the Americas to obtain safe vaccines at affordable prices to prevent many childhood infections and vaccine preventable diseases, resulting in a long history of successful immunization against polio, measles, rubella, flu, and yellow fever in the Americas. With COVID vaccine campaigns on the way, we are only at the beginning of the end of the pandemic. As vaccinations are administered, our goal must be to save lives of people by prioritizing the doses for those who are at the highest risk of infection, health workers who are treating COVID patients, the elderly, and those living with underlying conditions. I want to emphasize, never in history have we observed the rapid development and deployment of a vaccine in response to a pandemic. And it's this success, the success is really a result of collaboration among many partners. But while there's the reason for hope, we must remember that the doses of vaccines are limited. And it will be several months before most people in our region and globally receive vaccines. There are significant challenges to manufacture these vaccines at a scale that the world needs. It therefore requires continued collaboration to include the options for what we call technology transfer between countries, cooperation among countries like donation of doses of vaccine, global solidarity to find ways of how we can distribute the vaccines more equitably among countries. The momentum and unprecedented speed in the vaccine development and deployment observed so far must continue through investments in continued research, increase in manufacturing capacity, and in investments in delivery to ensure that all are safe globally. The COVID virus, I want to emphasize again also, has not disappeared. And we do need to continue to respect the public health measures. The use of masks, hand washing, physical distancing, and especially with the upcoming Easter break, I think we need to remember to continue with all these measures. However, the arrival of these vaccines through COVAX is very encouraging, as it means that more people will now be protected from COVID-19 in Belize. We look forward to the arrival, Minister, we look forward to the arrival of the other 66,000 doses of the first allocation for Belize. I want to congratulate the Ministry of Health and Wellness and the government of Belize for the current rollout of the COVID-19 vaccine and the reach to all people in all parts of Belize. PAHO and WHO will continue to work with the Ministry of Health and Wellness and other partners. And I want to acknowledge again Mr. Nicholas Hansman, not only related to vaccines, but the health system strengthening and related to retrofitting of health facilities and the work of the European Union, but also the IADB. We have had many discussions with them. And to support the further rollout of vaccines together with the known public health measures that can help stop the spread of COVID-19, protect health services, save lives, and also strengthen the economy, because they all are connected. Thank you very much.
Thank you, Dr. Jack. Our next speaker has been a champion for families, for children, and if you've been following on Facebook, she has also been championing the vaccination. And so I'd like to invite Mrs. Rossana Briceño, our special envoy for the development of families and children.
We are happy to be here today to receive this first installment of vaccines through the COVAX initiative. Through this delivery, more Belizeans will be added to the list of those who have gotten their first jab. The more persons we vaccinate, the better we protect ourselves and our families. Already, research has shown that people who receive the vaccine are protected from getting so sick that they end up in the hospital, or worse, end up dying from COVID-19. So yes, the vaccine saves lives. I think this is amazing, considering that 1 year ago we had thousands and thousands of people dying daily all over the world. And even here at home, we lost over 300 Belizeans. This is why this COVAX facility is so special, because it is an effort that has the world working together to ensure that countries large and small alike are able to get vaccines, so that as one human family, we can stop the spread of this dreadful virus. I say this with confidence. My husband is grateful to all of you for your patience and understanding. Our government is proud of you for the way you have cooperated by following the rules and guidelines that have kept the spread of the virus under control. For months, over 5,000 Belizeans have contracted the coronavirus. Today, working together, we have 37 Belizeans who have tested positive for the coronavirus. We did this together, and because of our efforts, we are now moving yet another step closer to winning the war against COVID with the phase rolled out of the vaccines. Es un honor estar aquí en una ocasión tan importante, tan significante para nuestro pueblo. Poder adquirir la vacuna tan rápido para un país como el nuestro es mucho más que un milagro. Es una demostración de lo que se puede hacer trabajando en cooperación y colaboración con todos los actores que ayudaron a hacer esta entrega de vacunas una realidad. El COVAX ha sido un vehículo muy eficiente y eficaz para lograr que las vacunas estén hoy aquí. Hoy nuestro pueblo ha demostrado que en una población que ha sabido combatir una pandemia que ha causado grandes estragos sanitarios y económicos en el mundo, nuestra gente, junto con todos los trabajadores de primera línea, han contribuido haciendo realidad la vacunación de nuestra población. Esto es el principio de la recuperación de un pueblo abatido, pero muy agradecido con todos los trabajadores, benefactores y todos esos que hicieron esto posible. A todos les pido y les imploro que aún hay que cuidarse y seguir los protocolos para evitar contagiarse. También hay que vacunarse cuando nos llegue nuestro turno para así protegernos, pero también para proteger al prójimo. Como una nación cristiana, tenemos esta obligación y debemos de hacerlo para asegurar que nuestro pueblo regrese lo más pronto posible a la normalidad. In the coming weeks and months, more vaccines will come through this COVAX initiative. And with your cooperation and by the grace of God, by Christmas, we should be able to get most of our adult Belizeans vaccinated. This will allow us to come together with family and friends in Thanksgiving and celebrate this holiday season. In the meantime, however, we must not let our guards down. We must continue to be vigilant together. This means that when it is your turn, you should get vaccinated. It also means that we should encourage all our family members and friends to get vaccinated as well, especially the most vulnerable among us. And we must continue with the 3 W's. Wear your mask, watch your distance, and wash your hands. Today is a good day. Our work to get rid Belize of the COVID-19 virus continues on pace, and our government continues its work to defeat COVID, which is one of the key pillars of Plan Belize. Let's keep moving forward together. To all Belizeans, I say on behalf of John and the rest of our family, have a safe and blessed Easter. Thank you.
Thank you, Mrs. Briceño. At this time, I'd like to invite our final speaker, last but certainly not the least, Honorable Michelle Shabat, the Minister of Health and Wellness.
Her Excellency, Mrs. Rosanna Briceño, Special Envoy for Development of Families and Children, and our First Lady, Ms. Alison Parker, UNICEF, Dr. Noreen Jack, our representative from PAHO, Mr. Nicholas Hensman from European Union, thank you for being here. Señora Embajadora, bienvenida. Ambassador Mai, welcome, thank you for being here. Our friends from UNHCR, thank you for joining us. To the team from the Ministry of Health and Wellness, thank you all for being here. Ladies and gentlemen of the press, welcome. Belizeans across our beloved country, thank you for joining in today. Today marks another historic milestone as we announce the arrival of 33,600 doses of the Oxford AstraZeneca vaccine to Belize. This delivery comes from the COVAX facility and facilitated through the PAHO revolving fund. The Ministry of Health and Wellness, on behalf of the government and people of Belize, extends our sincere appreciation for the team effort coordinated through our partners, PAHO, WHO, UNICEF, the European Union, and the IDB for negotiating, purchasing, and managing the shipment logistics on behalf of Belize. For some time, this shipment was our first hope of ensuring that the people of Belize would have access to the COVID-19 vaccines. And now we celebrate its long-anticipated arrival. With every dose that gets administered, we are getting closer to sustained recovery from this pandemic. Let us continue placing our confidence and hope in medicine as we rebuild our sense of normalcy on the foundations which the science of vaccination has provided to humanity. The COVAX facility is the global alliance ensuring equitable access to vaccines to countries that may otherwise face challenges in getting COVID-19 vaccines. Belize is expected to receive a total of 238,800 doses through the COVAX facility. The COVID-19 pandemic continues to be a major public health issue for which we need sustained mitigation and heightened awareness. The longer the pandemic goes on, the more severe the impacts on our citizens, especially on their health and well-being, their finances, right to education, nutrition, safety, and freedom of movement. We must continue doing our best, the best we can, to fight this virus, and we must acknowledge the efforts that each one of us is making. And I'd like to pause here to especially acknowledge the hard work that our healthcare workers have been doing. They have worked and they have sacrificed their lives and their family lives to make us safe. Our goal continues to be saving as many lives as possible by prioritizing the uptake of COVID-19 vaccines and by ensuring that our most at risk of infection receive their doses. To date, as a result of the generosity of the government and people of Barbados and India, we have been able to vaccinate 21,000 of our citizens. Our vaccination plan has now entered phase 2. At this time, we invite our teachers, policemen, members of the National Assembly, the judiciary, customs, and immigration, and all those persons involved with tourism who are 40 years and older to attend the nearest Ministry of Health and Wellness facility to be vaccinated. I extend a cordial invitation to all those adults 60 years and older and all those persons with special conditions who have not yet been vaccinated to do so. Each vaccinated person brings us closer to controlling this pandemic. As we commemorate this Holy Week of Easter, let us remember the responsibility we share to keep each other safe. This season, we ask you to remember the 3 W's. Wear your mask, wash your hands, watch your distance. When it is your turn, get vaccinated. Love them, protect them, vaccinate them. Be COVID-19 safe. Get vaccinated, Belize. On behalf of my family, I would like to wish all Belizeans a blessed and safe Easter. Thank you all very much.
Thank you very much, Minister. I'd like to invite you back along with the Special Envoy for the distribution of certificates. If you can come to the front, please. And so first I'd like to invite up Miss Allison Parker. Dr. Noreen Jack. And Mr. Nicholas Hansman. Ladies and gentlemen, this brings us to the end of our ceremony for today. I'd like to thank Minister Shabat and the members of the head table, as well as our distinguished guests, members of the media, those tuned in online. I'd like to reiterate what Dr. Jack said. Yes, we have the vaccines now, but COVID is still very much here. And so we must do our part to protect ourselves and our families. With that said, I'd like to remind you that when your turn comes to get vaccinated. With that, I'd like to wish you all a blessed and safe Easter. Thank you very much and good afternoon. And just for the members of the head table, we'd like to take some official photographs now. And for our guests, we do have some drinks and refreshments at the back. Drinks and snacks at the back. Thank you.